For some people, water can be a fun and relaxing environment, and for others, it's an important process of their rehab phase. I'm Gabby Smith. I'm a physical therapist assistant at Salina Regional Outpatient Physical Therapy Clinic, and I'm here to talk to you today about aquatic therapy.
Well, Gabby, thank you so much for being on the show. We're going to be talking about a type of physical therapy that you do in the pool, aquatic therapy. So kind of explain what it is.
Yeah, thanks for having me, Mike. So aquatic therapy is just a low impact program that we offer at Salina Regional Outpatient Clinic. We get patients into the pool. We utilize the YMCA here in Salina, and we utilize the buoyancy effects of the water. So I think that's probably the most common thing that people hear about when they're looking into aquatic therapy is the buoyancy. It's going to unweight our joints, reduce the stress that's being put there. There's also different principles that go into aquatic therapy that I utilize in my time with the patients. I use the viscosity, so that's like the resistance of the water. So not only are we able to unweight people while they're in there, but we're also able to strengthen muscles in a low impact kind of setting.
You mentioned the different conditions or injuries that you do. Why don't you talk about some of those?
So a lot of times I see chronic like back pain patients, or really just anyone who just can't tolerate land, whether that be because they just had surgery and they've got post-op like weight bearing restrictions, or they've got a neuromuscular disorder going on to where just land is not the best option for them. We get them in the water and they're able to utilize the effects of the water, the buoyancy, viscosity, kind of all those I listed before, and they're just able to move more freely.
And I assume people who maybe have some balance issues.
The water's pretty cool because it provides resistance from like all sorts or all directions. So you've got it from the sides, front and back, and so it'll push you to make the balance exercises kind of harder, but also it helps to assist you, utilizing the buoyancy effect, it helps assist you to stay up tall. So it kind of does two things at once, which is pretty neat.
Gabby, if somebody thinks that aquatic therapy would benefit them, what's the best way for them to go about looking into it?
So first of all, they'll have to get an initial eval done by one of our physical therapists at the outpatient clinic. So they'll go there, they'll chat with them, and from there the therapist will decide if aquatic therapy is the best choice for them or not, and they'll kind of come up with a plan of care just based on that. And yeah, that's pretty much then where I come into play.
Okay, well thank you so much for being on the show, and thank you for watching. For more information, you may visit the Salina Regional Outpatient Physical Therapy page on srhc.com under the Rehabilitation section.